Hey everybody, thanks for joining me today. This is Dr. Kevin Usry. I am here to talk to you about all about health and wellness, though today we're going to substitute the title to be all about auto accidents and attorneys. I'm brought to you today by All American Wellness and the efforts of Podcast Junkies. That's podcastjunkies.com, JUNKEEZ. Be sure to get in touch with Ben Castro, my producer extraordinaire, and Christian Perillo, who's the silent guy who lifts and puts wind under Ben's wings to do the job that he does, and he does an extraordinary job. If you want to get your message across to the masses, by all means, get in touch with podcastjunkies.com. Today I'm here coming from the wonderful town of Boca Raton. It's 90 degrees. It's hot. I got here a little early and decided to stop off and have lunch. So we're produced from Boca Raton in Florida. That's the southern portion of Palm Beach County, for those of you who don't know Palm Beach County well. And I decided to go for lunch, and I went to Patio Tapas and Beer. I didn't have the beer, but I certainly sat on the patio and had tapas. This is an authentic Spanish restaurant, and it was delightful. They're located right on Southeast 1st Street and 1st Avenue. If you're in the area, if you're within driving distance, by all means, go out there and enjoy yourself an authentic Spanish meal. And the dessert was lovely. They make a hot almond cake with vanilla ice cream that I have never had so much and enjoyed. It was just a wonderful experience. So I will tell you, go out and enjoy yourself. Have an authentic Spanish meal. In the meantime, let's get to the meat and potatoes of the show. I called it All About Auto Accidents, and here we go. So you've been involved in an automobile accident. Let's say it's even a minor accident, what's typically called a fender bender. Let me give you a little bit of physics. Let me give you a Physics 101. When you're involved in a car accident, let's just set up the scenario. Say you're parked at the red light and you're hit from behind by a car that was going about 5 miles an hour. Even though a lot of the insurance companies try and say, well, you couldn't have had much damage, they're shock-absorbing bumpers. Here's the Physics 101. Energy does not dissipate. Energy is transferred. So when you're hit with thousands of pounds traveling 5 miles an hour, you are literally pounded upon with thousands of pounds. Instantly, and I'm going to do a little imitation. So there you are, daydreaming, and all of a sudden your car is hit. Your neck goes rocketing back, rocketing forward, being stopped by your 3-point safety harness and rocketing back. This happens in 1 second. This is why people can't process what just happened to them. The brain just can't process that much trauma and that quick of an event and make sense of it. And this is why a lot of people are left shocked and dazed when they get in this car accident. Now, the average length of a trauma is 3 seconds. So let's do a little math. I just talked to you about the rocketing back, the rocketing forward, the rocketing back in 1 second. It happens more than 3 times. So within 3 seconds, here's what happens. The car is hit. The car initially moves forward. You have your foot on the brake, so you slam your foot on the brake. It's a reflex action. You have no motor control over it. This is just automatically what happens within 3 seconds. So your head and neck go forward and backward 3 times a second times 3, that's 9 times. 9 times where your brain has smashed against your skull. 9 times when you're where your neck has gone forward and backward at such rapid speed, the muscles, the tendons, which are the attachment of the muscles to the bone, all of the little fibers that attach the disc, that shock absorption mechanism in your neck, in between those 7 bones, those fibers are literally ripped from their attachments. And this is why people develop bulging discs and herniated discs and AOMSI injuries. What is that? That is the type of injury that literally creates a situation for you where you will never be the same. The ligaments, which are the stabilizers and guideposts for the bones in your neck that move in all sorts of different directions. It's the anterior and posterior, front and back, longitudinal, long ligaments that help stabilize your cervical or spinal bones in your neck and assure that they're guided in a proper fashion when you move forward and backwards, when you rotate, when you laterally flex. These are all the movements that we take for granted that occur every day. And when you have this type of ligamental damage, the bad news is that's a permanent injury. That will never heal back 100%. There will always be some kind of injury and some kind of management required because of that injury for the rest of your life. I know this is shocking. It's hard to process what I'm saying. I know. No, I'm not crazy. This is statistics. This is training. This is education that is 40 years in the making for me. And believe me when I tell you, this is what happens when you're in a car accident. And I just talked to you about the 5-mile-an-hour fender bender. I was just involved in an automobile accident. My first podcast here that I was going to do, I was traveling 65 miles an hour with my daughter on I-95, and I was hit by a vehicle that was changing lanes 2 at a time and just smashed right into my vehicle. Well, my head and neck went crashing side to side and back again, and during that second side to side, I hit the window of my car and damaged my brain and damaged my low back. And that was being protected by the 3-point safety harness. But my head and neck had no protection, no stabilization. And that's why I received the injury I received. Now, let's talk about a few things. What is the first thing you do in a car accident? Go to the attorney? No. You have 1 week, and I'm telling you from a clinical perspective, you have 1 week to get to the chiropractor to start anti-inflammatory care so you don't develop scar tissue. If you have a scar anywhere on your body, look at it. Does that tissue look like the other tissue around the scar? No, and it doesn't function either like the regular tissue. So when you have scar tissue infiltrate an injured area, the mechanical movement of those bones are no longer normal, and you will suffer accelerated degenerative changes that would have happened anyway as you got older and aged. It just accelerates it that much faster and will create arthritic changes once you develop these scar tissues. So what you want to do is start anti-inflammatory care, and that means a lot more than Advil or taking Tylenol. That means going to a physician that is going to be screening for these AOMSI injuries, these injuries that damage your spinal ligaments. Those permanent issues need to be looked at as quickly as possible so you can minimize the devastating effects it's going to have on your lifestyle and on your appreciation of life and daily activities. The first 6 weeks of an injury are like a magnet for scar tissue. So that's why you want to get ahead of the picture and treat yourself like you should be treated, like a valuable vessel. And that's what you should be doing. And when you do that, You will go to a facility that has a doctor that has experience and training and knows how to screen for these type of injuries that will have a big impact on your lifestyle, and screen for these injuries that are value drivers that eventually an attorney is going to want to have in his ammunition for settling your case. So finding a doctor who has experience and training to look for these type of injuries that can be documented and further documented with a final examination, so that provides the ammunition that an attorney will utilize when they go to settle your case. Now let's talk about that a minute. Everybody wants to get that $350,000, that $1 million settlement. Folks, there is no free lunch. Let's talk like adults for a moment. Do you think that person who gets $350,000 or $1 million settlement is that same person you see smiling on the billboard? No, their lives have been completely disrupted and changed for the worse. And the higher the settlement, the greater the injury, the greater impact on their enjoyment of life. And at that point, money doesn't mean a whole heck of a lot when you're suffering every day with myofascial pain syndromes. Now, let's talk about going to the right doctor. And since I'm paying for the show, of course I'm going to plug All American Wellness. So let me do that right now. If you're in Palm Beach County, there are some places you should be going. So let me tell you, if you're in Boynton Beach, you're 18 minutes away from All American Wellness. If you're on Indian Town Road in Jupiter, you're 18 minutes away from All American Wellness. If you're living on Singer Island or Palm Beach Island, you're 18 minutes away from All American Wellness. If you're living in Royal Palm Beach, you got it. You're 18 minutes from All American Wellness. We're 1 mile off of I-95, and we're on Prosperity Farms Road, 4 buildings south of North Lake. It's very convenient. Now, while I'm beating my drum and tooting my horn, let me tell you, I'm celebrating my 40th year as a chiropractor, and I have 5 specialties that I have spent 3 years on each specialty: orthopedics, nutrition, functional neurology, and acupuncture. So 15 years of postgraduate education. When you come to my facility, you're meeting a doctor who has 40 years of experience in dealing with automobile trauma and 15 years of postgraduate education in dealing with automobile trauma and injury. That's what you get when you go to All American Wellness. I provide for the attorney the ammunition for the value drivers in automobile injury cases. What are the value drivers if you didn't break your neck? If you broke your neck or broke a bone, you're not going to end up in my facility. You're going to be seeing a neurosurgeon or an orthopedic surgeon. But if you come into my facility, you are going to be screened for a traumatic brain injury. And those are types of injuries that create functional problems with your cognition. Cognition means how you use your brain. Can you put 2 thoughts together correctly? Can you remember things correctly? Can you sleep? Are you always irritable because you're not thinking clearly? That is a concussion, which in technical terms is a traumatic brain injury. We screen for that, we document that, and we treat that. We use the latest treatments for these. We work on the cerebellum, the cerebral cortex, and the mesencephalon to return that to normal function by using class 3 laser therapy and neuro re-education. And these are things that need to be done when you've suffered a trauma and you have functional problems with your brain. We also deal with AOMSI injuries. I keep mentioning that, so let me break it down for you. It's an acronym for alteration of motion segment integrity. It means ligamental damage. The segments in your spine don't move normally and will never move normally again. So there are certain things that you have to do. My opinion as a chiropractor, you don't want to do manual manipulation as we are taught, because we're taught to bring those joints to the very end of range of motion and make our adjustments. And those things are important to keep in mind, but when you have ligamental damage, you might cause trauma to the ligaments with a manual adjustment. That's why we use instrument adjusting. And this provides a reduction of vertebral subluxation, which we've discussed in the past, is the kind of problem that happens when the bones are not rotating, bending to the side, bending backwards, and bending forward properly. We simply use instrument adjusting, which is very comfortable, but it doesn't put stress on the ligaments. As we treat the patients for what are often presented as disc injuries, we use the latest technology to treat these disc injuries by using decompression and class 3 laser healing light. This is done for the first 8 weeks, and as the patient progresses through these particular treatments, we then teach the patients how to utilize at-home extension traction to realign and reorient the ligaments so that they are properly and synchronously moving the bones in the direction that is so frequent for people to move, in flexion and extension. We also treat patients, and again, this is my opinion, I feel the proper way to do exercise therapy with a patient who has suffered ligamental injury is not isotonic exercise, it's isometric exercise. By virtually stabilizing those areas and putting pressure that slowly builds to keep that area stable, you are directing exercise to the ligament itself, and you're bringing it to as much of a correction as the injury will let you obtain. Granted, once you've suffered these injuries, you're going to have an impairment. You're going to have an area of your spine that just doesn't move normally, no matter how much you want it to, and no matter how much we make attempts to get that accomplished. That's just the nature of the injury. Now, let's talk about the attorney. You've gone to the doctor, you've found the right doctor who has the experience and training, and you're happily being treated, and you went within a week, so you're well under the limits of the 2 weeks that Florida law requires you to follow, meaning you have 13 days actually to go see the chiropractor, your medical doctor, your urgency care center for some kind of documentation that you've had an injury and you're being evaluated for that kind of injury and hopefully getting the appropriate treatment. Now you get in touch with your attorney, because your attorney can't go to work for you until the doctor of treatment has finished his care with you and has written the attorney a report that documents your impairment. Impairment, as it's defined, is the inability of a particular area of the body to function at 100%. And when you have these impairments is how the attorney works his magic to get you a settlement for your case. You have to have proper documentation, accurate diagnosis of the injury, and you have to have an accurate final impairment sent to the attorney. Now he can go to work. What are you looking for in an attorney? You're looking for attorneys that have a long storied history of helping the community in areas of personal injury. Law firms that have an armamentarium of trial experience and board-certified trial attorneys that do their job in an excellent way. Let me make it easy for you. I've been working with the law firm of Lytle and Ryder for years. Why do I refer to them? Because they're an A-rated firm. They do excellent work. They are not afraid to go to trial and have a reputation with the insurance companies as such. So when they are trying to settle your case for maximum recovery based on the report that has been sent by a doctor with experience who follows the American Medical Association guidelines to the evaluation of permanent impairment. They will go to all aspects to make sure that you get that recovery, even if they have to go to court to prove themselves as your advocates for getting a fair and reasonable settlement for the injuries you sustained. Lytle and Ryder in West Palm Beach is your before and after. That's all you have to worry about. If for whatever reason you can't get there, I also recommend Gordon and Partners, again for the same reason. A-rated law firm that has an armamentarium of board-certified trial attorneys who excel in going to court and will be advocates for you. So 2 names, Lytle and Ryder, Gordon and Partners. Everything you need to know about an attorney, I've already given you. So make it simple on yourself. You get in a car accident, go to All American Wellness Center. Go within the week. Let us take care of your injuries. Let us send you to one of these 2 law firms that we use. And that's all you need to know. It doesn't have to be complicated. You've already had a traumatic event occur. You're already hit with all sorts of different things that you have to worry about. Go to the place that's going to worry about your injuries and take care of you, and go to the attorneys that are going to take all of those headaches of how to navigate who gets my car rental because my car's been totaled, who helps me with some kind of help getting my house taken care of because I can't even wash dishes, or supplementing some of the income I've lost because I can't get to my job. All of those things are handled by good law firms. So by all means now, you've had everything discussed with you that you need to know. That's it for this week. I appreciate you joining me. Again, you'll find us on Spotify. You'll find us on YouTube. You'll find us on Facebook. You'll find us on Apple. So look for us once a week. It's titled All About Health and Wellness. If you can't find us on All About Health and Wellness, look at Dr. Kevin Usry. And by all means, give us a call at All American Wellness. We're at 561-863-8779 or allamericanwellness.com. I look forward to meeting you. It won't be under great circumstances because you'll be coming in from a car accident, but I'm more than happy to be of service, as is my team. We're all about helping you get over this traumatic event that can disrupt your life. I'll see you next week. Thanks once again. Bye-bye for now.